Great. Well, I want to welcome everyone to our session. Today, we're excited to share the work that has gone into redesigning a complaint form and associated information and processes to better serve our community receiving, delivering, or impacted by behavioral health services in Colorado. As we get our session going, let's start with some introductions. My name is Stephen Ma, he, him, and I work for the Behavioral Health Administration. For brevity, we refer to this agency as BHA. My team and our larger division are tasked with the receipt of behavioral health complaints and the investigations and actions that follow. And with that, I'll pass the introduction over to Triana.
Hi, everyone. My name is Triana Kalmanoff. I use she, her pronouns, and I work for Bloomworks, a public benefit agency that works with governments to improve public services. And on this project, I served as a content strategist. And I'll pass it over to Greg.
Hey folks, I'm Greg Knaddison. I currently work for the Colorado Digital Service, and I'm a part of the BHA team working on this project as a web application engineer.
Hi everyone, my name is Karyn Lu, pronouns are she, her, hers. I work with the BHA in the technology and data division, and I was and still am the product manager on this effort. All right, let's go over our agenda. All right, so for our 45 minutes together today, we'll start by sharing some background information on this project, followed by how insights from our discovery work informed some really important improvements for our initial launch. Next, we'll share some work in progress on what we're doing now with ongoing testing and learning and some really exciting improvements in the works. And finally, we'll wrap up with Q&A. So feel free to drop in your questions throughout our session, and we will answer as many of them as we can. So thanks again for joining us. I will pass it on to Stephen to tell us a little bit about the background.
Thanks so much, Karyn. So to set a foundation for our discussion today, I will provide some background information about our agency. Your first question may be, what is behavioral health? You can think of behavioral health as the connection between daily habits and your overall mental and physical health. The types of services you're likely familiar with in the broader universe of behavioral health are things like mental health treatment for depression and anxiety or other psychological states, substance use disorder treatment for issues related to drug and alcohol abuse, and services like eating disorder treatment and recovery or crisis services. When BHA launched in 2022, the vision was to take the state's historic work of overseeing behavioral health services in Colorado and to evolve them to be a trusted, for us to be a trusted authority to lead the development and the state's vision and strategy for behavioral health and its continuum in treatment for children, youth, and adults. With our agency, while our agency performs a broad array of tasks from contract and grant management to data collection and analysis to legislative advocacy and support for various groups like tribal nations, youth, and criminally justice involved individuals, our focus today will be on BHA's oversight function of behavioral health services, particularly those that are licensed by BHA. We're responsible for ensuring access to quality behavioral health services to all those receiving care in our state. A vital part of this oversight includes effectively receiving and responding to complaints when behavioral health service issues arise. Behavioral health complaints cover a broad range of topics and have a varied level of severity. People speak up hoping for better care and to feel heard. Often events have already transpired that can't be remedied, but people still reach out because they don't want the same thing to happen to someone else. People are concerned about things like mistreatment, neglect, or abuse, their rights being recognized, especially in the space of involuntary mental health treatment, poor facility conditions or unprofessional behavior, billing issues, and also just being able to find care or treatment and get connected to it. Data from our most recent fiscal year that closed at the end of June demonstrated that our top categories for complaints were about quality of care and services, unethical practices, safety concerns, and abuse and neglect. Next, let's talk about who these complaints are coming from and who they're coming to. BHA receives complaints from individuals and organizations, including people seeking or receiving services, or from their family members or caregivers. Staff at behavioral health providers are often folks that provide us information too, or we also get referrals from state agencies or other organizations, or from members of the general public. While BHA strives to take complaints from anyone and provide them with a no wrong door experience through our investigation and response, complaints are also submitted to other places, like directly to behavioral health providers, or to other state agencies like the Colorado Behavioral Health Ombudsman, the Department of Regulatory Agencies, who oversees the licenses for most of our licensed health professionals in the state, the Department of Human Services, the Department of Health, who licenses our psych hospitals, HCPUF, who oversees our state Medicaid program, or the Department of Corrections, who is our largest behavioral health provider in the state of Colorado. Next, we have an example complaint to share that has been edited for brevity and anonymity.
No Name Behavioral Health is understaffed and failed to meet basic standards in their operations. There was little control of the patients or what they were bringing in. One patient gave my child drugs and offered to get high with them. Another patient showed up visibly intoxicated, unable to walk normally, and was allowed to participate with the group. My child took drugs and brought in other people's urine for several weeks. More than a week passed before I was informed of my child's failed urinalysis. My child overdosed at school in their 8th week and was taken to the hospital in an ambulance. I called the caseworker and clinical program director many times to find out where my child would be discharged. They never returned my calls. The director emailed me a list of rehab facilities to, quote, explore on my own. No Name was zero help in finding follow-up care. I filed a complaint with No Name about these issues and nothing ever happened. These facilities are completely unregulated and there is little to no effective oversight to ensure they are meeting their care obligations.
Thanks, Triana. I'd point out that this example does a good job of demonstrating both how complex complaint matters often are and how much is at stake for the individuals seeking help by filing complaints with BHA. From this specific complaint example, let's zoom out a bit and look at the broader complaint process in these 5 steps. So first, intake. Complaint intake come through electronic form submissions, phone calls, emails, or even sometimes direct word of mouth. Regardless of the source, we intake all complaints into a spreadsheet tracker, and then we get to our next step, which is to triage them to complete our internal review and assign the complaint to a licensing manager if it's an agency that BHA licenses. Next up, the investigation phase. The licensing manager and our complaint support team investigate the matter to determine the best course of action as guided by our rules. Regular investigation practices include record reviews of things like client records and charts, video surveillance, review of personal training records and supervision, as well as interviews of persons with knowledge and staff that may be present when we perform announced or unannounced site visits. Next, we get to our outcome. If a violation of BHA rules is determined, BHA takes action to resolve the issue to return licensed agencies into compliance. This could be through issuance of violations and an agency completing plans of action. In more serious cases, probationary periods may be imposed with restrictions on the license and additional BHA oversight. In the most serious of cases, I should say, a license can even be suspended or revoked to take away an agency's right to provide those services. In other cases, there may not be a violation of BHA rules that's established, but there may be opportunities to coordinate that individual's care or to utilize other teams or resources within or outside of BHA to assist in connecting individuals with the care they're seeking or to further investigate the issue. Lastly, we gather information from the complaint process into the spreadsheet to track and complete analytic functions. I'd note that both the intake and analytics tasks are hampered by some manual entry processes. Continuing to talk about kind of our historic state of things, these screenshots show how our complaint website looked in the very recent past. I'd call out that the information about how to submit a complaint or the process that's involved is very limited here. Moving forward, we're also going to share the complaint form as it existed through that previous website and in previous forms. So the entry form was through a Google form you can see portrayed in this series of screenshots. My co-presenters will discuss more about these issues, but the Google Form platform presented limited opportunity for development to better fit our needs. There were access issues that presented issues for some that tried to submit complaints, and the appearance of the form failed to portray the professionalism that we strive for. In addition to these issues with our website and submission form, as BHA's influence and public visibility has grown, our complaints have increased in leaps and bounds. As you can see in this chart, we have more than doubled our complaint receipts over the past 2 fiscal years. While we welcome this upward trend because it offers opportunities for us to help people in need, to improve services with individual licensed providers, and to use analytics to drive system-wide improvements overall, it's also a pain point, especially when it comes to the time it takes to complete manual entries for our tracking and analytic tasks. It has been made all the more important for us to have quality website resources to guide informing the public about the complaint process and to improve both the public's interface with the form and our back-end work as BHA staff. We know that improving data and processes and technology around gathering and evaluating complaint data are a key to improving experience for everyone, from the public seeking assistance to our BHA staff that seeks to help. Now that we've discussed some of the challenges we've faced, I'll turn it over to Karyn to pivot towards how our team started working towards solutions.
Thanks, Stephen. So before we wrap up this section, I wanted to share an insight about how we got started. So Greg and I are both part of BHA's Tech and Data Division, and how we got to do this work was initially through looking at a public dashboard on the BHA website that holds the agency accountable and is transparent about certain data points, such as the number of complaints we receive. So there was a strong focus on this dashboard at the time, and framing the need around more complete data specifically for that dashboard enabled us to get the funding for the tech and data team to get involved in the first place. And that included not only myself and Greg's time, but also the opportunity to bring on the fantastic team from Bloomworks, which included Triana. So we've been, as this came together, reflecting on the relationship between data and user experience. And it feels like data issues can often be the result of upstream usability issues, which feeds into the cycle of how data and UX are sort of intimately linked. And it's interesting because the work of improving data, and by that I mean both the quantity and quality of it, necessarily means improving the user experience for everybody who touches that data. But to be clear, it was the data focus that got us the funding to do the work. I think if we had led with improving user experience or content design, there probably would not have been an opportunity at that time to do the work, and we certainly wouldn't be where we are here now. All right. I will pass it on to Triana to talk about our work together this past year.
Thanks so much, Karyn. So I'm going to be talking a little bit about our 3-month project together last year. And our goal was really collaboratively to understand the complaints process throughout the state of Colorado. We wanted to improve the experience of submitting a complaint as well as the data, like Karyn mentioned. And we worked together, all of us on the call, as well as many people on our teams that aren't here today, in order to work together to design an improved process from data collection through integration and analytics. And that included work on BHA's website, complaint form, staff processes, and BHA's data lakehouse. And we'll hear a little bit more about some of those in a minute. And in order to really understand the landscape, we started off with talking to many, many people. And that included subject matter experts, both from BHA and partnering state agencies, as well as behavioral health service providers. And we also talked to residents of Colorado that had received behavioral health services, including people who had cared for others receiving behavioral health services. And what we found was, in short, a confusing and inconsistent landscape. Agencies across Colorado collect different information, they use different terms, and they handle complaints very differently. And what that meant is that people that receive behavioral health services did not understand how to submit a complaint, who to submit a complaint to, and what to expect after they did that. And all of these issues appeared downstream as data issues. And so what we did is a number of things, but what we'll talk about today is that we developed a new standalone webpage for complaints that explained the process, what you need to do to submit a complaint, what you can expect after. We improved the existing form in a number of ways that you'll hear about in just a second. And we developed a data model to integrate complaints with other agencies. That's still in the works. And to sort of frame all of the work that we did, we led with plain language. And what we meant by that is that what we found is that a number of agencies across the state, including BHA themselves, use different terms to describe the same thing, and the same term describe different things. You can see in the image on the right, this is one paragraph on BHA's original Contact Us page on their website that described the complaints process. And you can see 4 different terms used to describe roughly the same thing here. We have concern, dispute, complaint, and grievance. And really what we did first was to align everyone on the project around the term complaint.
I want to chime in here and just give credit and huge thanks to Stephen for being a champion of this from the very beginning. His decision as one of the key stakeholders here to use the word complaints consistently, both inside and outside of BHA, just really set the tone for the entire project early on. I mentioned that we had been framing the project around data, and in a way, Stephen's kind of backing of this decision gave us permission to do a lot more of the content design and UX work that followed, I think, in a much more open way. So honestly, since then, it has not only changed how we speak about complaints to people of Colorado, but also in how we speak about complex topics more plainly inside the BHA as well. And everyone is better for it.
Thanks, Karyn. The next thing that we did is really tried to add what we're calling a trauma and equity lens here, and recognizing the sensitive nature of a lot of the topics that we are handling with complaints. By nature, behavioral health topics can be quite sensitive, and complaints are especially heavy and traumatic at times. They're when people have been wronged or hurt by the system. And so it was important for our team to understand that we were working with issues that were coming in and compounding over time. So we wanted to make the system easier and better for Colorado's most vulnerable residents. And that not only included making technological challenges easier, but also improving human translation and thinking about language and form design. In the line of plain language, we used person-first language as well. And so that was helpful in standardizing the language and preventing victim shaming or blaming. In usability testing, a number of participants mentioned that they didn't want to be seen as a complainer, and that was really important for us to take note of. This is also consistent with the way that BHA's content style guide uses person-first language. They use the terms person with a drug addiction or person in recovery instead of addict. And we also validated experiences with compassionate language. This seems a little flowery, but essentially what this means is that we made sure that people understood that it's their right to be heard, and that we were actually really wanting to hear what is going on for them. So we used tools and content strategy to lower reading level. And in testing, we found that people really appreciated, knowing why complaints are important, and that their complaint really did count. And Greg's going to read us a quote from usability testing here.
Sometimes when you're complaining, you're like, oh, wait, am I overreacting? Should I really be doing this? But I think this is good because it's saying it's okay to complain. Like, okay, maybe I'm not overreacting. Maybe I should be heard on this.
Thanks, Craig. The next thing that we did is we really tried to set and then meet expectations, both on the web page and the forum and all of the ways that we were connecting with people that would be submitting a complaint. And this is particularly true because the original information on the website didn't have very much information about what a complaint was, what people would need to submit one, and what they could expect afterwards. And so you can see here, this is a screenshot of an updated version of the form, basically the introductory paragraph to the form itself, what people can expect. And in addition to having information about how long somebody might expect before BHA hears back, we also made sure to send confirmation messages. And all of that really is an attempt to make people feel more in control of their experience and reducing anxiety. And Karyn's going to read us this quote.
Another usability testing participant said, "It feels like if they're going to update me, then someone's actually looking at this. It's not going to go into some big black hole where no one sees it."
Thanks, Karyn. Another thing that we did to really address sort of the trauma and equity perspective is to address privacy early. And this is one thing that emerged during usability testing. We discovered that participants really did not understand the difference between confidentiality and anonymity. People really felt comfortable knowing that anonymity was an option, but they didn't understand, and they were surprised to find out that that meant they couldn't get updates about their complaint after they submitted it. And so unfortunately, we couldn't do anything to really fix that because that's just how confidentiality and anonymity works. But what we were able to do is clarify the difference really early on. You can see this content again at the top of the complaint form, and we also added that information to the website. So clarifying that difference early on helped people feel more comfortable and helped to rebuild trust. If people are coming to this forum feeling harmed by the system, we wanted to make sure that we were as transparent as possible about people to make an informed decision about what they're sharing that might have impacts to their own safety and healthcare service. And the next thing we did was we made the form shorter and easier to navigate. We tried to reduce the burden on people submitting the form and discovered that a number of questions were difficult to answer for people that were filling out the form, as well as questions that BHA already had the answer to. So one of these examples is a question on the original form asked, region served. That was actually how the question was phrased. And we discovered only 6% of people were answering this question, maybe because they didn't understand the question and maybe because they didn't know the answer to the question, what region they were in. But it turned out that BHA actually had this data that they could link to from a different source. And so we moved towards doing that. We also swapped out language that was difficult to understand, like primary client payer source and things like unlawful termination. So using plain language to describe things. And when we couldn't change the language, and even when we could, we tried to explain how questions would be used, like why we were asking for this information and how we were going to use it. And we found that that was helpful in making sure that people understood how their information was being used and more comfortable sharing the complaint. And now I'll pass it over to Karyn and Greg to talk about what their work has looked like since the end of our discovery project together last year.
Thanks, Triana. Yeah, fast forward to today, the momentum really has not slowed at all. In fact, to this day, we continue to have weekly work sessions between our two divisions. So after the Bloomworks Discovery Sprint wrapped up, we did roll out the improved Google form. We followed that with another round of usability testing, which validated many of the improvements that were made. And then from that feedback, there were a number of small improvements we were able to make pretty quickly. So the one that stands out to me was simply reorganizing a very long county dropdown in a way that just made more sense to users. So for example, Denver as opposed to city and county of. So all of those iterations, next slide, please. We're talking about were to improve upon the Google form. So for context, Colorado runs on Google Workspace, so we do have a lot of Google Forms out there. But at the end of the day, our biggest challenge was actually the platform itself. So certain providers in Colorado block Google altogether, meaning if a provider is on site, they cannot access the form online. Additionally, Google Forms requires users to sign in to upload any kind of documentation. So the impact was really significant. Many users could never see the form at all, and it was impossible for someone to actually submit an anonymous complaint. So we heard from users who faced both types of barriers. And basically, no matter how much we improved upon Google Forms, it would always mean that we do not hear from a potentially significant number of people who do want to tell us about their experience. So these were some barriers that we could not remove. So our internal team, we knew this. We were pretty clear about all of the technical reasons that Google Forms is probably not the right tool to be using for complaints. And we knew that intellectually, but honestly, we never sort of considered other types of barriers. And this is where we want to share something really surprising that we learned from users during this round of testing. All right, so the most interesting and consistent feedback we got was about Google Forms itself, and this one sums it up pretty well.
95% of the Google Forms I've had in my life were for surveys for people's college thesis projects or filling out for a Dungeons and Dragons night or dietary information before a wedding. It doesn't feel very official. It feels a little personal when I'm putting in what is essentially somewhere in the spectrum of medical legal information.
So every single user that we talked with commented on how Google Forms felt surprising, informal, unprofessional, and we had no idea that the emotional reactions would be so strong. So from there, we then made an incremental improvement followed by a much more significant improvement. So for the incremental improvement, we moved away from the default Google Forms theme and we restyled it with BHA colors and fonts and a header image, all of that hopefully gave more confidence, a little bit more confidence to users that, that their data will be handled appropriately. And then, more excitingly, for the more significant improvement, we realized that to remove these barriers, what we needed to do was to move away from Google Forms altogether. So I'm going to hand it over to Greg to tell us more about that.
Thanks, Karyn. Yeah, so after some analysis, BHA felt that the right tool for collecting this data was Qualtrics. Since this project had already redesigned and then validated the form quite a bit, we started out with a fairly straightforward copy or porting of the functionality into Qualtrics with minimal changes that were required by the nature of the Qualtrics platform versus the Google Forms platform. We did quality assurance on the form and then were able to launch it earlier this month. So now we have a recorded demo to show the process going from a Google search through to the landing page that was created as part of this project, and then the Qualtrics form in preview mode. Compared to a year ago, searching for reporting a mental health complaint is dramatically improved. The results page now shows useful information in the AI summary drawn directly from the new page. The dedicated complaint page has a good call to action in the page title, increasing the click-through rate. Since launching our new complaints page, the site's position on the search engine results for key phrases has moved from about number 4 to about number 1. On the Submit a Complaint page, you can see the primary focus on submitting a complaint with these 2 call to action buttons. On the right is a secondary focus for helping people in case of an emergency. We have links to both Spanish and English forms, as those are the 2 most common languages in our community. We did pursue professional, human-translated form since it's important to get the meaning of the words right in this context. Lower on the page are plain language explanations of how complaints improve care, which help support people submitting a complaint know the value of sharing that information with the state. The page goes on to explain the process, managing expectations, and providing alternate submission methods in case the main method does not work. The Qualtrics form preview, shown here, includes a synchronized desktop and mobile view simulator. This next section of video is shown at double speed. The question about contact information is an example of a gating question asking yes or no if I want to share my information. And when I say no, the form skips showing me 4 questions about my contact details. So now I'm continuing filling in the form, answering in a way to reduce the number of optional questions. We currently estimate that it takes 10 minutes for a person to submit a complaint. Towards the end of the form, we show a summary page, allowing the submitter to review the information they've provided and go back to fix any information. And after submission, they're presented with a page of additional support and a further link where they can get more information about the process. Alrighty, so that's it, end-to-end process there. Lots of work rolled up into that pathway. So a significant number of technical and emotional problems identified in the usability tests are improved by moving the data intake form to Qualtrics. And we recognize that Google Forms was a good choice for the state of Colorado at the time that BHA adopted it, but we believe that Qualtrics is a better choice for the project at this time. We will have a QR code available on the last slide so that you can download these slides in case you want to read them in more detail. So where are we going next? On the next slide. Yeah, thank you. Throughout the process, we've investigated what is working well and areas for improvement. And the project kicked off with the main goal of improving the data quality and completeness of data that the BHA has to inform its work. That goal led us into improvements in the intake and analytics phases of the complaint process. And we now feel like we've made significant improvements there, but it feels like it's no longer worth significant investment into those phases of the work. By moving to new tools along the way, we've also unlocked the ability to make improvements at the triage and investigation phases, areas where our current research indicates that there are problems worth investigating. As Stephen mentioned, it's a fair bit of manual work in those phases. So in the future, we may look for technology and process improvements in the outcome area as well, of course. And I'll pass back to Stephen.
Thanks so much, Greg. So the ultimate goal is to have a more elegant, effective, and efficient complaint process. And as we look at the removal of barriers, both for submitters and submitters of complaints and for BHA staff, reducing administrative burdens and receiving higher complaint volumes, we continue to be more successful in that. With the work we are so honored to have been able to discuss with you today, we can confidently say that we really are achieving better government one form at a time.
Thanks so much, Stephen, Karyn, and Greg. Now we're going to turn it over to a Q&A section. And I have a couple questions I want to start off with, but if anyone that's watching has a question for our panelists, please use the Q&A feature and I will pass those along to everyone. So to start off, I want to ask Karyn, Stephen, and Greg, what made BHA able to carry this work forward? We all worked together last year for a few months, but you've been remarkably able to work together really, really beautifully in the last year to continue a lot of this amazing work. You launched this amazing forum this month. Can you share a little bit about what made BHA able to do that and what advice you'd give to other agencies looking to do something similar?
Triana, I'd be glad to maybe take that first. I think one of the biggest
Yeah.
takeaways for me is just that there's things that my team and myself, we do really well. And there's other things that we don't have a lot of subject matter expertise in. So getting to work with folks like yourself and Karyn and Greg has really been hugely valuable in helping us do things that we couldn't accomplish alone. And one thing that I think also just is more subtle is the fact that we look at this stuff all the time, and sometimes you're too far in the forest to see the trees. And so having just some of the thoughts along the way from our usability testers and even weekly from Karyn and Greg to kind of say how things occurred to them when they haven't worked as in depth in the actual complaint work has been so tremendously valuable. So it's given us a lot more perspective and more tools in the toolbox to do this great work.
Thanks so much, Stephen. Karyn or Greg, anything else you want to add? Okay, maybe I'll move on to the next question, which for me, and then we'll turn it over to Q&A. What's next? What are the things you're most excited to work on next for this project?
I'm excited to hear from all of you too and what you're excited about. But one of the really cool things about our move to Qualtrics, which just happened this month, just a couple weeks ago actually, was that Qualtrics actually has a ticketing system built in, meaning it enables like pretty good case management functionalities. And right now, the complaints that are coming in are going into a Google spreadsheet, and the quality and standards team are using the spreadsheet and Google Drive folders as sort of like a makeshift case management system. And with the move from the form to Qualtrics, it opens the ability for us to get to design, like co-design a whole new, better case management system for the division as well. And we get to do that together. So it's a kind of a whole new adventure, and I'm really excited to see that happen as well. What about you all?
Aaron, I really share that excitement. I think, as I had talked about the increased complaint volumes, I think, as I had mentioned, it shows us that we're getting the matters of concern to us. But I think as part of us being able to scale up and continue to actually respond timely and have the best outcomes possible, having resources like that will take manual steps out and give us a more streamlined approach are going to be tremendously valuable and important. So I'm really excited that we're already to the stage of working on that because the elevated workloads are already here.
I'm definitely excited about that as well. I feel like one of the great lessons of this project for me has been the way that the initial usability tests that we did, the facilitated observed usability tests, highlighted certain problems, and they were kind of pretty consistent. And then we fixed those and or did what we could to address them as best we could. And then we did another round of testing and identified new problems. And so I feel like that repeated testing and it validated the second round validated a lot of the fixes that were implemented. People would comment about, oh, I feel supported here, where in the initial tests they would say, oh, I feel concerned, or like, should I actually be filing this? So I think I'm excited, I guess, about continued research and analysis of this tool, but also of other tools that are used by BHA.
Yeah. I'd just plus one to that, Greg. I mean, that's a huge part of what enables us to continue to work too, because every time we do a round of testing, we get incredible insights that allow us to move forward. And it truly was sort of like one thing led to another. I don't think, when we first started out with Bloom, looking at improving that one public dashboard, that we knew we would today be working on a different platform and a case management system. But all of those incremental improvements and insights and learnings just sort of like opened one door after another.
Great, thanks so much. There's a ton of questions. I'm going to turn it over to what folks have already asked, starting with one of the most votes. I can imagine this may be a hard sell for some folks in the agency. Better complaint tracking likely means more accountability. How did you bring folks on board with these improvements?
I think it's a great question. I think part of it is that a lot of the launch of BHA had to do with us having accountability and having this accessibility from the public to reach us and get help. So I think it cuts both ways. We're required to do that, we're expected to do that, but also we're empowered to do that. And so I think one of the reasons that being able to work on the project has been, it's fit into that, and it's also been a huge relief, again, to kind of have be working towards a better system for managing all these processes, is because it is very visible, and the way that we respond to these complaints, the way that we do this work to get people's matters of concern to us, um, it it matters to us as professionals and the goals that we have to run this organization, but it also matters to the people in the state that legislatively put together this, or we're a part of task force that built this, or stakeholders elsewhere in the process that have these expectations for us.
Thanks so much, Stephen. Greg, this might be a question for you. There was a brief explanation of this that I missed. How are you able to improve SEO or search rankings for your form? Oh, Greg, are you there? Okay, we're going to move on to the next question while Greg comes back to us. There's a question about a monthly service fee or a one-time purchase for Qualtrics, and also if there's a license required specific to like Adobe, being like specific to a person or for multiple users.
Hi, Greg, you're back. On Qualtrics, I think that is a question probably for your procurement team. I imagine there are lots of different tiers of licenses, and we do have an enterprise level license, and that is what is going to enable us to scale Qualtrics across the board. I mentioned we do have a lot of Google Forms, and many of them face the same barriers, right, of providers not being able to access the form at all, for example. So we are in the process of migrating more over with that license.
Thanks so much, Greg. There was a question about search engine optimization.
Yes, sorry about my network glitch there. What we did to address that was basically that the complaints content was part of the contact us page at first. And by putting it on a dedicated page and answering a lot more questions, that provided the keywords that people are searching for related to filing a complaint in the page title and in the headings of the page, and just a lot more of those keywords altogether. So those are I think pretty typical search engine optimization techniques, just to break it out to its own page, gives it that focus. It also gives it a better title in the search engine results page. So if you're looking to submit a complaint and you see the word submit a complaint in the title there, then that's going to improve the click-through rate to help people find exactly what they need. It further helped with like the AI summary now is much better as well. So it feels like a lot of strong benefits came out of that, splitting it to its own page.
Thanks so much, Greg. Looks like we have time for one more question. How did you convince the stakeholders that are set in the traditional method of filling out forms and move them toward the scalability of managing multiple forms at once? Anyone want to tackle that one?
Triana, could you read that just one more time? I'm sorry, I'm not actually seeing
No
that
worries.
correctly.
How did you convince stakeholders that are set in the traditional method of filling out forms? And the second part is moving them towards the scalability of making multiple forms at once, which maybe for different agencies that have their own complaint form and then also have to use the BHA form, maybe working with stakeholders.
Well, I don't think that that's work that's completely, over and done with. I mean, there really, as we had mentioned in the presentation, there's still other places that complaints do go at this point in time. And so I mean, I guess like our first step at trying to address some of those issues, though, one is that we have tried to kind of have a no wrong door policy. And what that means to us is if something comes into our agency, that we will try to get it to another agency in a lot of cases. And we also are trying to work more closely with some of those sister agencies to kind of have things land in the right spot to begin with, or to work really seamlessly to coordinate, looking to help folks between offices.
I might just end by saying, in the short term, since short time since we rolled out the Qualtrics form, we've already seen a pretty dramatic rise in the number of complaints that we're getting, and it's really fun to be able to say getting more complaints is success. But that's true, right? The more data we have, the more we'll be able to use that to continue to make all of these improvements and get more buy-in every step of the way.
Great. Well, that wraps up our session today. You can download our slides here or access them and reach out to us on the platform if you have any additional questions. Maybe we can start and answer the rest of the Q&As offline. But thank you so much, everyone, and have a good rest of the day.